Skull fractures. Factors influencing skull fractures. Skull fractures depends upon the thickness, density, and elasticity, which varies from person to person. First is thickness. The thickness of the skull, average thickness is 6 millimeter. Different skull bones are of different thickness through. Occipital bone is thickest at 15 millimeter. Frontal bone 80 millimeter. Parietal bone 7 millimeter ആണ്. Temporal lobe 4 millimeter. The skull is thinner where is protected by thick muscles. Buttress skull is thicker in the mid-frontal portion, mid-occipital portion, pareto-sphenoid portion, pareto-petrous buttress. The thickness of ഇത് ബ്യൂട്രസിൻ്റെ കാര്യമാണ്. ഓക്സിപിറ്റൽ മിഡ് ഫ്രോണ്ടൽ സ്ഫിനോഡ് പരേറ്റസ് സ്ഫിനോഡ് it is stable, less likely to break. There are 3 pairs are there. Maxilla sphenoid, zygomatic bone frontal. Okay. So the thickness of the outer table of skull is twice that of inner table. The inner table is thinner and more brittle than the outer table, which is more resilient. The skull is thicker in most races, thicker in Negro than in Caucasoida. In all races, bones of the skulls are thinner in a woman than in a man. The weight of the adult head 4.5 kilogram. Force required to fracture a human skull, that for skull with a soft tissues 11,000 lb per inch square in the frontal bone, 550 in the parietal bone, and 225 lb square in the zygoma. For cadaveric head 35 foot-pounds. This force can be generated by a stone weighing 90 to 120 gram thrown forcibly, or a weight of 2.25 dropped through a distance of 1 feet. For dry skull without a covering or condenser 3.3 foot-pound. Density of is increased density, area of increased density between the squamous part of the temporal bone and parietal bone. Area of decreased density in frontoparietal region, in the neighborhood of coronal suture, above the roof of the orbit, in a small segment above the internal occipital protuberance. Okay. Relationship with brain injury. There is no relationship of extent of fracture with concomitant brain injury. There can be extensive skull fracture without any brain injury. Conversely, there can be extensive brain injury without a fracture. Sometimes a thick skull without a fracture may produce more damage than a thin skull with a fracture may caused by a Thank you.